Alright, let us focus on this particular bone, like which is one of the important identifying feature bone that we have to know and identify. This is a hip bone. It's a kind of like just like any bone we start with, we have to talk about any bone, how does it look like? Is long or short or kind of having a shape or not? Truly speaking, it don't have any shape actually. So, you call them as irregular bone. This one is irregular bone, just like the vertebra, just like the scapula. This is also a irregular shaped bone. Now, this have got like a 3 different bones amalgamated, united together to make this particular single piece of bone. We call them as hip bone. It has a 3 parts. This part is expanded, we call them as ilium. Then this part which is a little bit like a club like or like a swollen and has a bony bar, we call them as ischium. And this point which is present in here, we call them as pubis. Now, this irregular bone have got holding a foramen inside. This particular foramen which is present, we call them as acetabulum or acetabular foramen, which is basically present between the 3 of them, and it is encircled by this piece of the bone. On top of this particular foramen acetabulum, we have a semicircular depth or groove. This particular groove we see that nearly circular, right. So, this groove is, we call them as facet. This facet we call them as this groove we call this facet we call them as acetabulum facet, and this one is we call them as obturator foramen. So, this opening we call them as obturator foramen, and top of that we have this particular groove, we call them as acetabulum or acetabular notch or acetabulum space. So, these are the like general features or general parts of this particular bone. Now, apart from that, this particular like individual parts of this particular bone we have to identify, just like this part of this particular bone we call them as ilium bone. Though this ilium bone have got like a few things which is have that it has a border, we call them as anterior, which is posteriorly placed, posterior border. It has upper border which call them as superior or superior border. So, superior border is also known as iliac crest, and it has a medial side or medial border, and as well as it has 2 surfaces. One is on the outer side, lateral surface, which is known as gluteal surface. So, this one is giving attachment to all the glutes or gluteal muscles. Inside to it, which is facing the inner side, which is the inner side of this domain, which is known as the ischial fossa, which is known as iliac fossa. This particular part which is giving attachment to a muscle which is known as iliacus. So, this particular region we call them as iliac fossa. So, these are the like 2 spaces which are present to this particular bone, which is like significant to it. Then if you just like follow this particular bone, is it like if it is like keeping in anatomical position, which we are going to learn little bit later. So, if you just like move back towards this particular side, you find a notch in this side. So, this notch we have a bigger notch, then we have a smaller notch. So, this notch we call them as sciatic notch. The bigger one we call them as big or greater sciatic notch, the smaller notch we call them as lesser sciatic notch. And in between these notches we have a bony projections. So, we call them a spine. So, this spine is related to this particular bone which is known as this ischial bone. So, we call them as ischial spine. Now, this particular ischial part or which is like ischium, which is rolling down and moving towards anteriorly or joining with this particular bone. So, this particular bone we call them as pubis, which is this one. So, the pubis is present on the anterior side. Now, this right side pubis joining with the left side making a joint, you call them as symphysis pubis, this one, right, intervened by a cartilage or. So, this particular cartilage which is present inside in between to it makes this particular joint as a secondary cartilaginous joint. Now, this particular pubis, it has like a few points. This part of the pubis which is present in here, where you see that this is a body. So, this is known as body of the pubis, and this pubis have got like a projection. So, one is projected up and one is projected down. So, this downwards projections and the upward projections we call them as ramus. Ramus means horn. It projected, like if it is a body, it is down, this is one projection, this is another projection. These 2 projections are known as ramus. So, this particular ramus we call them as upper and lower ramus. So, superior and inferior ramus. The inferior ramus, you can see that going to join with this particular bone we call them as this ischium bone. So, this ischial bone has got like another projections which is known as the ischial body to this particular ramus, and together we call them as Ischiopubic rami. So, where this ischial ramus and this pubic ramus is joining together we call them as Ischiopubic rami, which is making a lower boundary for the opening, which opening we call them as the obturator opening. Now this particular obturator opening have got like a space inside to it, which is present in here, we call them as obturator crest. So which is basically allowing some structure to pass through, we will talk about it. Now talking about this particular like pubis, you see that this particular pubis have got this particular border, we call them as superior border. This border we call them as medial border. So which is making a joint. So this part which is making a joint, which is midline, right? So this border we call them as medial border or medial surface. Likewise, this border which is present above, we call them as superior border. So this superior border which is present from this particular medial border or medial end to this particular point where you can see a bony prominence. So till this part we call this as pubic crest, this part. So in between this region we call them as pubic crest. So this pubic crest is limited by this particular bony projections. This particular bony projections where you see that, which is a bump, we call them as tuberosity or tubercle. So this tubercle which is present in this particular bone, we call them as pubic tubercle. So this pubic tubercle is an important landmark, that what you have to keep in mind. So between this medial border to this pubic tubercle, this border we call them as pubic crest. These pubic crest words will be coming again and again. So anatomically this pubic crest, pubic tubercle and this medial border or symphysis pubis is very important for our understanding of the surgical or this particular clinical anatomy is concerned. Beyond this particular point, we have this particular thing which is going above here. We call them as pubic pectinate line or pectinate region. So which is going on above, ending in this particular bony region. So we call them as this line which is going above from this particular pubic tubercle, we call them as pectinate line or pectineal region. So which is another bony projections which is going above. Now coming to like talking about the anatomical positions, then again we will be coming back to this particular point. So whenever you are holding the bone, you have to know which is above, which is down. So this particular expanded part or the ilium bone is above and down is this particular point, we call them as this tuberosity. So this tuberosity we call them as ischial tuberosity, which is projected below, and this one is projected above. Now we then above and below, if you are decided, then we have to know about anterior and posterior. So anterior is this particular point which is known as this particular point, we call them as Anterior Superior Iliac Spine, ASIS. And this notch which you are seeing here back side, which is known as sciatic notch. So the sciatic notch is posterior and this one is anterior. So this notch is on the back side and this projection is front side. So anterior is this one, posterior is this one, above is this one and below is this tuberosity, ischial tuberosity. Then you have to know medial and lateral. Medial and lateral is identified by this acetabulum. The acetabulum is on the lateral side for fitting of the femur head, which is making a joint which is known as hip joint. So this one has to be placed lateral side, and this one opposite to that we have this particular surface which is known as this particular iliac crest, which is on the medial side. So if you are just like considering three of the factors above, below, this is above, this part we call them as ilium bone, and this one is tuberosity down. Then we have to know the medial, which is like a symphysis pubis or this particular surface, or pubis is the midline, and then we have this particular lateral which is present on this side. So which will be like present on this side is will be like the acetabulum will be facing laterally. So this medial and lateral decided, above and below decided over there, and anterior and posterior is decided by this particular symphysis pubis will be facing forward and anterior superior iliac spine is forward, and then we have this particular sciatic notch which will be placed on posterior side. So keeping this all together, we have to decide on the which is above and which is below, which is medial, which is lateral, and fold it in accordingly which side you are seeing. So this is a right side of hip bone. We are holding three bones together: ilium, ischium, pubis, with a cavity or this like a bony deficits over here. We call them as obturator foramen, and this bony cup or bony depression we call them as this acetabulum. So once you have identified this particular side of it, then you have to hold it in proper angle. we call them as like holding this particular bone in normal angle or proper angle. Thing is that this particular bone, anterior superior iliac spine, and this pubic tubercle which is present in here should be on same vertical plane. So, it will be held in normal vertical plane, right. So, this will be, if you just like a draw a plane or draw a line, these two should be touching together. So, this is what you will be having it whenever you are having this particular in line. So, just like keep you like a fat of the palm and this make it straight, and once you make it straight, then you have to touch this particular pubic tubercle and this ASIS into touching together. So, they are touching together, that makes this like a plane you have decided, this plane. Other thing is that the center of this particular acetabulum which you are seeing here and this particular like anterior superior iliac spine will be on same vertical line. So, if you are joining this particular thing together, they should be touching the same vertical line. That means, then once you touch this particular thing plane you have decided, then you have to tilt it down, so that this thing center of it and this one should be on same vertical line. So, this is like not like holding it flat, rather you have to tilt it, make sure that this center of it, if you just like draw a vertical line, this line and this center will be passing like this vertical line. So, it will be like this, and this highest point of this particular iliac crest which is known as iliac tubercle, which is present on here, which will be 5 centimeter from the midline. So, if you see that in the midline, so it will be little away from midline like this. So, this is like a tricky bone to have this held in normal anatomical position. So, you have to consider the 3 factors whenever you are holding it in anatomical position. First thing is you have to decide which side it is. Then once you have this particular thing have got different planes to have this in anatomical position. So, having these things anatomically decided, so above, below, anterior, posterior and medial, lateral you have to decide. Lateral one is decided easily by this particular one which is acetabulum, which is lateral. So, if you just like place it laterally, then anterior, posterior, above, below is automatically set, but you have to know how to just like this hold these things. Then once you have this particular bone decided on medial right side and left side, you have to have this in accordingly the side it belongs. If it is right side hip bone, you have to have it on the right hand. If it is on the left side, you have to have it on left side. So, once you have this, then you have to keep these angles of this particular bone. This is not like lying straight, it has a little bit angled. So, normal this particular bone which you are seeing here, it is not like this, it is angled. So, normal positions or normal anatomical position. So, this angle matters to it. So, angles is matter is over there, the plane that you have to see. So, the plane is that the pubic tubercle and anterior superior iliac spine should be on same vertical plane. That means, if you just like a place a cardboard or something, this is vertical, then you have to say touch it this anterior superior iliac spine and pubic tubercle. Once you have this thing is done, then you have to make this particular ASIS and this particular center of this particular acetabulum in the same vertical line. So, this is a center of it, and if you just like drawing a vertical line, it is not touching. So, you have to tilt it like this, so that these things are touching like this. So, this is what you have to trace it and touch it like this. So, then you have to place it in a way, and then third thing is that this highest point of this iliac crest, which should be little bit 5 centimeter away from midline. So, it will be not like in the midline, little bit away. So, it will be just like a rotated like this, then you makes these things together like holding in normal anatomical position. Alright. So, this is what you have to practice again and again to have these 3 things considered about the plane of this, of the vertical line, and this like proper inclination, like it is not straight, it is little bit forward moved. Now, coming to individual parts of this particular individual bone. So, this part which is expanded like this, we call them as ilium bone. So, this particular ilium bone is kind of like expanded and flat, it looks like Japanese hand fan, right. So, this particular expanded part which you are seeing here, this particular it looks like a blade, like expanded blade. So, this particular like a bone have got borders, like this border we call them as anterior border, because it is anteriorly placed. So, this is anterior border have got features, this is a bony projections, then it has a depression, then it has again another bony projections, then it is having a depression, then it ends into acetabulum, right. So, these projections which is present in here we call them as Anterior Superior Iliac Spine, ASIS. Then we have a notch, then we have another elevation. So, we call them as Anterior Inferior Iliac Spine. So, this anterior border have got Anterior Superior Iliac Spine, then notch this Anterior Inferior Iliac Spine, then we have another notch. So, ASIS notch, Anterior Inferior Iliac Spine, then again another notch. Likewise, if you just like move on the back side, they have the same features. So, this one which is having a projection, then notch, then projection, then again notch. Clear? So, this particular projections on the back side, likewise this ASIS we call them as anterior, instead of anterior it will be posterior and it will be superior. So, posterior superior iliac spine, then we have a notch, then we have another projections, then it will be inferior. So, posterior then inferior iliac spine, then we have a notch. This notch leads to this greater curvature. So, this curvature we call them as greater sciatic notch. Then this greater sciatic notch leads into this bony projections, we call them as spine. This one is a part of this bone, ischium bone, we call them as ischial spine. Then ischial spine, after that again we have a notch. This one is sciatic notch which we call lesser sciatic notch. This lesser sciatic notch leads to this particular bony part, we call them as ischial tuberosity. So, this ischial tuberosity is this piece of bone which leads to this particular ramus of the ischium. This ramus of this ischium and the ramus of this pelvis joins together. Together we call them as Ischiopubic rami, which is a common thing, common rami. The superior ramus of this pelvic bone, which is basically single, does not have any contribution, directly ends into this particular acetabulum. So, the superior ramus and inferior ramus of this like the pubic bone, which is having a body which is having two horns and have got two different directions and blending up with two different bones. Now, coming back to this same bone we have talked with. So, this particular anterior border, this is posterior border. Now, this border we call them as superior border. Now, this superior border which you are seeing here we call them as iliac crest. Now, iliac crest in the anterior superior iliac spine to this particular region have got two lips. You can see that there is an outer lip, there is an inner lip. So, this has got lip and this particular tissues are there, like bony tissues are there in between. So, this whole thing we call them as iliac crest. So, this particular iliac crest, as you just like anatomically move down from the anterior superior iliac spine to this particular point 5 centimeter from the anterior superior iliac spine, it has the highest point. So, this particular highest point of this particular iliac crest we call them as iliac tubercle. We call them as iliac tubercle. This iliac tubercle is again important for us to identify. So, iliac crest and iliac tubercle. So, that is what you have to keep in mind. So, then it is going down on the posterior side and posterior side is making a bulbous things, we call them as iliac tuberosity. So, this iliac crest have got two bony projections, one is the highest point we call them as iliac tubercle and again little bit on the back side which is projected down we call them as iliac tuberosity. So, do not get mixed up. So, if you cannot remember the iliac tuberosity, does not matter because anatomically or clinically the iliac tuberosity does not have that significance, but this highest point of the iliac crest which is known as iliac tuberosity, that is the important thing, that gives iliac tubercle, that gives a important clinical landmark for doing clinical examination, right. So, this is what we have to keep in mind regard to it. Then we will be talking about the muscle attachment subsequently later on about these particular bones. So, this had got anterior border, posterior border, superior border also known as crest. Then we have this particular border which is related to it, which is called them as like which is joining over here, which is known as the medial border, which is going to join with this particular like the lower part of the bone, acetabulum over there. Now, other than this particular thing, we have this particular surfaces of this particular bone, this surface which is facing laterally, we call them as gluteal surface or lateral surface. So, these gluteal muscles are attached to it, we call them as gluteal surfaces. This one we call them as iliac fossa, we have a muscle attached to it, we call them as iliacus, we will talk about this later on. Now, this gluteal surface as we can see can be divided by three lines. So, we call them as posterior gluteal line, medial gluteal line and inferior gluteal line, which is basically separating this particular iliopubic eminence or this particular acetabular origin to like this. So, this anterior inferior iliac spine from this line to this particular greater sciatic notch, we have a demarcating line, we call them as inferior gluteal line. Then from the posterior side, we have posterior gluteal line and medial gluteal line. Gibbs, this particular thing is divided into the spaces. This particular spaces, if you can remember, it is fine, does not have any significance other than the muscles are attached into it. So, this gluteal muscle, gluteus medius, minimus, maximus, they are attached to it, minimus, medius, maximus, this is how they are attached to it. But if you cannot remember these lines like posterior gluteal line, medial gluteal line, inferior gluteal line, just like know that there are gluteal lines are there, gluteal lines are for attachment of the gluteal muscles, 3 different gluteal muscles are there. That is it, that is what we have to keep in mind regard to it. And on this side we have one single fossa which is occupied by the muscle, we call them as iliacus. Iliacus we have seen the dissection scene probably, and the rest of the muscles will be visible when we are going to see the pelvis. Now see that on the inner side, this is like gluteal side, which is known as iliac fossa. Now apart from that, if you just like see that in between them we have this particular line extending, which is known as pectinate line, which is separating out here. We get a surface here as well under to it on the medial side. So this surface we call them as pelvic surface. So this pelvic surface is the inside to it. You see that inside to it, this surface we call them as pelvic surface. So which is inside to it, holding the cavity of it. So this surface we call them as pelvic surface, and this surface you see that roughness is there. So this is giving an attachment to the sacral bone. So this is a sacropelvic surface. Where is the sacral bone? This is the sacrum. Sacrum is attaching on it. So this is attaching with the sacrum and blending with the pelvis. So together this surface, which is we can see the rough there, we call them as sacropelvic surface. So this sacropelvic surface gives an attachment to this particular region which is known as articular surface, which is giving an like ear like surface, auricular surface which is present, and then we have this particular bone elevation which is called them as iliac tuberosity, so which is present on these sides, and then we have this posterior border, posterior superior iliac spine, notch, posterior inferior iliac spine. So these are the like general features that we have to keep in mind regard to this particular bone, which is this ilium bone, which is present above the acetabulum, wided, expanded, looks like Japanese hand fan. It has borders, 4 of them are there, anterior border, posterior border, superior border, these are the 3 one important for us, and then we have the medial border which is separating this particular bone from the pelvic surface actually, right. So this pelvic surface is separating from the medial surface, going in the pelvic surface and sacropelvic region or attachment surface, alright, articular surface or articulation of the sacrum bone. Then the anterior border have got feature, anterior superior iliac spine, notch, anterior inferior iliac spine. Likewise on the back side, posterior superior, posterior inferior, and then notch. Then we have the greater sciatic notch ending into this particular spine, ischial spine, then lesser sciatic notch, then to this tuberosity, ischial tuberosity. Now to these particular surfaces, we have this surface, lateral surface, also known as gluteal surface. The gluteal surface can be divided by these lines, inferior gluteal line and posterior and middle gluteal line, into these areas for the attachments or giving in a rough indications of attachments of the different gluteal muscles like gluteus maximus, medius, minimus. This is how they are attached. Inner side or the medial side, we have this fossa, we call them as iliac fossa, for the attachment of the muscle iliacus. Now this particular iliac medial surface is separated from this particular like the pelvic surface, which is downside below by this particular continuations of the line, we call them as pectinate line or pectinate line, which is extending to this particular rough region, we call them as articular surface or sacropelvic surface, sacrum with the pelvis articular side. It has an articular margin, looks like ear, we call them as auricular surface, looks like ear. So that is why it looks like an ear. So we call them as auricular surface, which is basically giving attachment to the lateral plate or lateral mass of the sacrum. And then we have this particular part of this ilium bone which is dilated, we call them as tuberosity, ilian tuberosity. Now this superior border have got features which we call them as superior border as iliac crest. Iliac crest has a highest point, we call them as iliac tubercle. Iliac tubercle, that you have to keep in mind. Other than this, we have this outer table, inner table of this iliac crest and this intermediate area. So which is giving attachment to several muscles into this particular region that we are going to learn slowly, right. And then if you move back laterally, it becomes thinned out, it has the same margins are there, like a lateral margin, outer margin there, but this particular crest is is having importance over there. The importance of the crest is that this particular crest is for piercing the crest, which is subcutaneous, we can reach into the substance of the bone or get access to the bone marrows which is present to it. So, iliac crest can be used for doing bone marrow aspiration, just like in a bone we have here, we have sternum. So, sternum bone can be used to aspirate the bone marrows. This particular bone is also subcutaneous, we can feel this particular iliac crest all the way down, and as well being a subcutaneous, this particular crest can be used to pierce through and get a bone marrow for doing clinical examination. So, this is what we have to keep in mind. Other than this, we have this particular foramen like a depression, we call them as acetabulum. This acetabulum is usually covered by a bony cartilage, we call them as acetabular labrum. Just like glenoid labrum, we have seen that it is cartilage which is present, and the inferior margin of this particular acetabulum having a deficiency, we call them as acetabular notch. So, this acetabular notch is filled by some ligaments which are present to it, which call them as transverse acetabulum ligament like this. And then this acetabulum is holding this particular a head of the femur to make a joint, which is making a hip joint of the subsequent side. This acetabulum can be divided into three parts, like upper part, medial part and lateral part. So, contributions of this particular acetabulum is from three different bones. So, major contributions of the acetabulum is coming from this upper bone or ilium, more than 2/5, less than 2/5 is from the ischium and less than 1/5 is from the this pubis. So, these are like acetabulum which is basically contributed by this, and at the point of the acetabulum or center of the acetabulum, these particular three bones actually unite together. So, this particular acetabulum is for that region, is basically a union point of three bones, like one bone, two bone and three bone together. So, when we are born with, we have three different pieces of bone. Then as we are developing in the embryonic period, these three pieces of bone comes together close by and joins, and when it completes the joining, this particular bone which is produced over here, no union point is there. So, before that we have this particular union point, and coming together this particular union point is center of the acetabulum. So, the center of the acetabulum is having a significance, is the union point for these three bones. Embryologically this is important for it. Then coming down to this acetabulum, we have this foramen, we call them as obturator foramen. The obturator foramen leads to a tunnel like space, we call them as obturator crest. Obturator foramen have got margins like anterior margin, posterior margins, inferior margin, superior margin. The superior margin leads to this particular crest or a groove like things, which is grooving to this region, which is allowing some structure to pass through. We will talk about this later on. And it has an external surface, the acetabulum, and has an internal surface. So, this external and internal surface of the acetabulum or acetabular cavity, the obturator foramen have got muscles attached to it, membranes attached to it, which will be coming on the attachment point. Now, from this particular bone, we are moving to this particular bone. We have this bone, we call them as the pubis bone. So, pubis bone is the midline most, so which is present in the midline. So, this pubis have got few parts. This part of the bone, bony plate, we see that we call them as pubic body. So, this particular pubic body is basically have got 2 points, which has got medial surface or medial border. The medial border of the right side and left side unite together, making a joint, we call them as symphysis pubis. So, this particular pubis have got medial border or medial plates which is present in here. Then we have this particular pubis has got surface. This surface we call them as superior border. So, superior border, this point we call them as pubic crest till this particular bony point. This particular bony point on it we call them as pubic tubercle. So this is pubic tubercle. So from here to here we call them as pubic crest. So from here to here we call them as pubic crest. That's what you have to keep in mind, or you have to remember always. This body has got like other surface like anterior surface, posterior surface, or like a pelvic surface. This one is inside, we call them as pelvic surface because it is below the pectinate line. So pelvic surface or external surface, this is what we can call it. And then we have this particular horns or projections, inferior horn, superior horn, also known as ramus, R-A-M-U-S. So this one is inferior ramus continuous with this particular ramus of this particular bone. So together they have a union point somewhere here. So this union point we call them as this together piece of bone, we call them as Ischiopubic ramus. And then this is have superior ramus. Superior ramus is continuous from the iliac crest and then leading to this particular iliopubic eminence. So this particular eminence is between the pelvic bone, which is pubis bone, and this particular ilium bone, we call them as iliopubic eminence. Now this particular ubic case leading to this particular line we call them as pectinate line, which is basically continuous on the back side separating between the iliac surface and the pelvic surface. And this particular from this particular bone we are moving to this particular bone. This particular bone we call them as ischium. This part of the ischium we call them as body of the ischium, and this is ramus of the ischium. This ramus joins here. This one is do not have a ramus, basically body joins with the like acetabulum. This particular ischium or ischium tuberosity have got like a expanded part, upper part and lower part. Upper part is little bit like square, lower part is triangular and spanning down into this particular point we call them as ramus. So this particular part, upper part and the lower part have got different muscle attachments. So upper part which is square shaped have got different muscle attached, lower part which has got different muscle attachment. That's why you have to separate or segregate in it. So this particular ischial tuberosity moves back towards the back side of the acetabulum, makes a bony prominence. This particular bony prominence we call them as ischial tuberosity. So this ischial spine. So ischial spine is splitting between these particular two spaces, we call them as curvatures. This one we call them as greater sciatic notch, this one is known as lesser sciatic notch. So this particular greater sciatic notch and the lesser sciatic notch, as you can see here, gives an attachment to different ligaments. So if you see that this ligament which is coming from the sacrum to this particular ischial spine, we call them as sacroischial spine, which is making this particular notches into the cavities or foramens. So greater sciatic foramen, lesser sciatic foramen, in a living condition we get it. In a bony cadavers or bony tissues or bony specimen we get only the notches. So this is about the general feature of this particular bone, ilium, ischium and pubis, and along with the acetabulum and the foramen which is present as the obturator foramen. So you have to just like see that particular bone in your hand, see that if you can identify this particular bone which side it belongs to, and if you can identify the side of it, then you have to hold it in proper angle, like anterior superior iliac spine and the pubic tubercle should be on same vertical plane. The center of this particular acetabulum and this particular anterior superior iliac spine should be on same vertical line, and then this particular ischial tubercle should be 5 centimeter from the midline, little away. So keeping these three things together, you have to so anterior, posterior, and then above, medial, down, which you have to identify. Vertical line হলো সেম প্লেন হয়েছে 5 সেন্টিমিটার posterior, হ্যাঁ ওটা টিউবারকেলটা দেখা, ইসচিয়াল টিউবারকেল, হ্যাঁ ইসচিয়াল টিউবারকেল যেটা আছে ইলিয়াক ক্রেস্টে ও, হ্যাঁ 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 ওটা 5 সেন্টিমিটার ফ্রম দ্য মিড লাইন। আর এরা প্লেনটা কি সেম আছে, তো দুটো কি সেম ভার্টিক্যাল প্লেনে আছে, অ্যান্টেরিয়র সুপিরিয়র ইলিয়াক স্পাইন আর পিউবিক টিউবারকেল, এটা ভার্টিক্যাল হলো বুঝলাম, কিন্তু তোর অ্যান্টেরিয়র সুপিরিয়র ইলিয়াক স্পাইন আর পিউবিক টিউবারকেল সেম প্লেনে আছে, সেম ভার্টিক্যাল প্লেনে আছে, কোথায় সেম ভার্টিক্যাল প্লেনে আছে? সেম ভার্টিক্যাল প্লেন মানে স্ট্রেট লাইনের মধ্যে থাকবে, স্ট্রেট প্লেনের মধ্যে থাকবে, এইটা না, অ্যান্টেরিয়র সুপিরিয়র ইলিয়াক স্পাইন আর টিউবারকেল, হ্যাঁ হ্যাঁ পিউবিক টিউবারকেল সেম ভার্টিক্যাল প্লেন, সেটা দেখা স্টেপ যেরকম করে দেখালাম আমি। সেম ভার্টিক্যাল প্লেন, ওইদিকে ফিরে, ওই দিকের সাথে ফিরে দেখ পয়েন্টগুলো ইয়ে কর। লাইন আর প্লেন ডিফারেন্ট, লাইন মানে স্ট্রেট লাইন,